Good. Anything else that's here?
Shortness of breath.
Shortness of breath. So what, can you describe that a little more? What do you mean by shortness of breath?
So when I was younger, I used to have panic attacks, and I used to feel like I can't breathe.
So you would just not be able to breathe at all?
Yeah.
So I would say that would be a freeze thing. Now, how do we tend to breathe when we are in the stress response? Faster and shallow. You see people on TV when they're really angry, or they're well, that's the one that's most obvious. And you see their chest are just going, oh, I'm going to get him. Right? Why does that naturally happen? What's the function of short, quick, shallow breathing? What are we trying to make happen? I don't know if there may be a little bit of blood breathing connection, but there's something that's even more involved with short, shallow, fast breathing. What is our body trying to do? Yeah, it's trying to get oxygen in way faster, with the idea that I'm going to need oxygen to help create energy at the cellular level. If we still don't do something about it, if we're still going, okay, I'm still going to stay up in fight or flight mode, by the way I'm thinking about things, then we start to notice these strains start turning into pains. So let's go through some of these. These are more obvious. What are some of the... So tell me again. So this, what you said, goes here. What you said you have... So chest pain, popping, and then what else? Was that mostly it?
Pretty much. I kind of like, it starts in one spot, and then if it gets really bad, it will kind of like cramp.
It's like what?
It feels like a cramp in my
A cramp. Okay, this is interesting. Hold on one sec. Or is it related to that? Oh, go ahead then.
I have the same thing, and I used to think it was like heart attack.
It feels like that painful.
That's like what?
Okay.
It would feel like.
Now, I want to explore something that is a little bit down the road, but since both of you mentioned this, I've really been studying this a lot lately. And, you know, if you look at if you were a health scientist, somebody who was studying health as a profession somehow, and somebody said, okay, I need to know the main risk factors for heart disease, what would you probably say? The commonly held risk factors for heart disease. What are the ones that we know of? Because heart disease is number one for the most common chronic disease, correct? So what are the things that tend to lead toward that? What? Okay, sitting around too much. Smoking, for sure. Yeah, unfortunately, that's not as big a deal as it used to be, thank goodness. What else do we know of?
Diet.
For sure, what we eat. If it's a high sugar diet, high bad fat diet helps out. What?
How much stress they're carrying.
Okay, so hold on to that part. Because they don't, and until recently, they wouldn't acknowledge that stress was a piece of that. Yeah, if you've got buildup of plaque in the blood vessels, it increases the likelihood. And what tends to lead to atherosclerosis? Because of, yeah, primarily because of high blood pressure, right? And smoking, the nicotine creates high blood pressure. If you're a guy, your chances is higher. The older you get, the chances are higher. So I saw one study where they took into account all the things that, all the kind of risk factors that lead to heart disease, and they could only account for about 50% of all of the heart disease that's out there. 50%. So the question is, what's the other 50% that's leading to the lots of heart disease? Say it. It's because of stress.